Welcome back to Healthy Living. So we talked about Men's Health Month, and that is in June, but also in June is National Cancer Survivor Month, and there's National Cancer Survivor Day also in June. So my next guest is Arlyn Arseneaux. She is the Director of Cancer Services and the St. Tammany Health System Infusion Suite. And so we're really happy to have Arlyn with us. Thank you so much for joining us.
Thank you for having me.
And taking the time out today to come. It's always nice to talk with colleagues. And when we talk about, first of all, tell us a little bit about yourself. What do you do at St. Tammany Health System?
Well, I've been with St. Tammany for 22 years now. I started there as a new grad on the inpatient oncology unit, transitioned over to manager of that same unit, and recently over the last year I've transitioned into the outpatient setting at the Cancer Center. So I help manage our support services, integrative oncology department, our navigation team there, our tumor registry, and then I have the hospital infusion suite.
Okay, you have so many hats that you wear. We could talk all day about what you do. Actually. So when we talk about National Cancer Survivor Month, you talked about one of the things you do is the integrative care, which I know that people, I don't know this, but I think that lots of people think about cancer and they think about cancer diagnosis and treatment, but there's a whole world of integrative care around that treatment, and it's from start to finish to survivorship.
Absolutely.
So let's talk a little bit about that, because I don't know that everyone knows what we offer and what you get to implement every single day on the job. So let's talk about the integrative services a little bit, if you don't mind.
Sure. Not all areas have integrative oncology, so it's very nice that we can offer this to our patients. So integrative therapy takes care of the whole patient, not just certain aspects, from diagnosis all the way through survivorship, and survivorship begins at day of diagnosis. So we have a whole team of people available to guide these patients through their journey. We have an integrative oncology nurse practitioner who has a more holistic approach. She focuses on symptom management, so patients don't have to delay treatment, dose reduce their therapy, which will take longer to complete their treatment.
Right.
She focuses on the 7 pillars of health. We also have acupuncture at the Cancer Center to help patients with symptoms such as neuropathy, nausea, vomiting, common symptoms associated with treatment.
Right, and this is if they want to do these things, correct?
Absolutely, absolutely.
It's their choice.
It is their choice. It's a complimentary service. You don't have to be a patient in the Cancer Center to have these services. Patients can self-refer. If you're a survivor going through treatment, newly diagnosed, these services are available to you as well. We have a team of physical therapists, speech therapists. We have dietitians available for nutritional counseling. We have social workers to help you with any needs that you may have. The team there is very, very wonderful to work with. They're very patient-centered.
And we have the little area off to the side where we have classes there for meditation, yoga, Tai Chi.
Absolutely. It's
all
part of our lanyap services. We have yoga, Tai Chi, we have a music therapist, meditation. We have support groups that are offered down there. It's a wonderful, wonderful thing for our patients. We have a wig boutique that's run by our social workers to help patients pick out the best wig for them. It's really wonderful.
And we also have the food pantry, which is to pick up your nutrition, and it's nutrition-based food, correct?
Absolutely, absolutely. We have a couple of services available for patients in need. Our therapeutic food pantry helps patients that may have a food insecurity, fresh produce, dairy, eggs, canned foods available to patients that have a need. We also have a transportation assistance program. Some people are receiving therapy 5 days a week and are having trouble getting to and from their treatment, so we're able to help them with that.
Right. So you said at the beginning that survivorship starts at diagnosis. And that means that from day one, we want every cancer patient to survive.
Absolutely.
And so walk me through, like, when you, in your role specifically, we have lots of accreditations, we have lots of recognitions. How do some of those things kind of connect with the patient's treatment and diagnosis and survivorship journey?
Well, you know, a lot of what we do is quality care, so we want to make sure that we're providing the best quality. Our integrative nurse practitioner, she provides patients with survivorship care plans that help guide them after their treatment is done. So it talks to them about what their treatment was, any long-term or lasting side effects they may experience. What's next? What tests do I need? How often do I need to follow up? So they have this information and they can share it with their other providers.
So that helps them not only while they're with us, but throughout the rest of the time that they, you know, that they are surviving this journey.
Absolutely.
And you talked about your work on the tumor registry. What is the tumor registry?
So the tumor registry is a group of people. They're certified tumor registrars. It's a job class. They help manage our cancer data. You know, our data goes back to 2009. Class of case, primary diagnosis, helps us with our statistics. What are our most common cancers? What areas do we need to improve? How are we doing with treatment areas? Things like that.
So it informs the care of every patient going forward.
Yes, absolutely. We can look at historical data, you know, look at our current data to see what are we doing well, what are some areas that we need to focus on.
Okay. So we know that, you know, National Cancer Survivor Month is in June, and we have National Cancer Survivor Day in June. We are going to celebrate National Cancer Survivor Day in September this year,
That's right.
Instead of in June. But tell us a little bit about that event.
So this year it's going to be held on September 22nd. Mark your calendars, 11 to 1. It'll be held at the Cancer Center. It's just an event for patients, staff members, caregivers, family, friends to come out, support people in their cancer journey, bring awareness to some of the struggles that patients who have cancer go through on a daily basis.
Right. And everyone's welcome. So where's the Cancer Center located for folks who don't know?
It is right off of I-12 and 21. Can't miss it. 900 Ochsner Boulevard. Brand new, well, almost 2 years old now. Beautiful building, and it's usually held in the parking lot there.
Okay, good. So along with all of these things we do also have opportunities for people who want to support cancer services to come in or to connect with us and make a donation if they want to. So we want to mention that for sure. You can go to www.sthfoundation.org/cancercare to make a donation. They have a Walmart wish list set up. You can give gift cards, puzzles, things like that. But Arlyn, while I have you here, before we wrap up, is there anything else you want to add as far as speaking to our integrative care, our support services, our survivorship in general?
The only thing I'll say is we have a wonderful team that's very patient focused there, and everything you need is in the building. So you're not going to one place and the other place. It's kind of one-stop shop.
Right.
Physicians, lab, support services, everything that you can possibly think of is located in the building. So it's really great for patients to be able to visit and have their care in one place.
Well, good. Well, thank you again for joining us, and we look forward to National Cancer Survivor Day that we're going to celebrate in September.
Yep, more to come.
Say the date one more time.
It's September 22nd from 11 to 1.
Okay. And it'll be at the Cancer Center at 900 Ochsner Boulevard.
Correct.
So thank you all for joining us for this edition of Healthy Living, and we will see you next time.